Hello, everyone, and welcome to NETEC's next webinar in our COVID-19 series. Today, we're going to be talking about PPE compliance and fatigue in the first responder realm. My name is Amanda Grendel, and I'm very excited to be able to moderate this webinar today. I am on faculty with NETEC and located in Atlanta, Georgia. A little bit of overview of how today will go. Today, we're going to do a little bit more of a town hall style. So you'll hear from me first, and then we'll get into our wonderful panelists that we have, Dr. Kumar, Dr. Carr, Ben Tizer, and Wade Miles. They'll introduce themselves a little bit later. If there's time at the end of our webinar, we'll be able to answer some of your questions. And then you'll hear me come back on and we'll go over some of the NETEC resources. So for those of you who are not familiar with NETEC, NETEC is National Emerging Special Pathogens Training and Education Center. Our mission is to increase the capability of the U.S. public health and healthcare systems to safely and effectively manage individuals with suspected and confirmed special pathogens. If you haven't been before, we do have a wonderful website that has lots of resources at www.netec.org. Also, if you have a question or would like to speak with an expert, please feel free, again, to email us at info@netec.org. Within NETEC, we have four kind of departments. We have our assessment department, which really is focused on metrics. There's availability for you to do a self-assessment. There's also availability for you to request on-site or now virtual assessments. Next, we have education. We have lots of resources, like I just alluded to on our website. We have online training. We offer in-person and virtual courses. And then we have webinars, just like we're doing today. We also have lots of flyers, animations, and things of that nature. Technical assistance is where you can reach out to get on-site or remote guidance. We have a very large repository with lots of plug-and-play tools and resources for you. Some of those include large exercise templates. We also provide an emergency on-call mobilization. And lastly, we have a research infrastructure. We have our online repository that gets rapid implementation of research protocols. We've been able to develop policies and procedures and data collection tools. And then we also have a specimen biorepository as well. All of these activities interface with each other, and they're all available to you. So today we're going to get started with kind of our town hall panelist version of our webinar. So again, we're going to be talking about compliance and fatigue issues related to PPE in the first responder realm. These four panelists will introduce themselves as they answer their first question, and then we will go from there. All these questions that we'll be talking about today are ones that you submitted when you registered for your provided your registration today. So if we have time afterwards, remember, please use that question and answer function, and we will get to those as well. So the first question that you all submitted today is, I had COVID-19 in July. I recovered, but now I'm back at work. Do I still need to wear the same PPE as those around me who haven't had it, or am I immune to it? So I'm actually going to ask Dr. Carr if he feels comfortable to answer this question and to introduce himself before he does that.
Sure. Thanks for the reminder to introduce myself. I would have totally forgotten. So my name is Michael Carr. I'm on faculty at Emory University, and I work clinically at Emory University Hospital. And I'm also a member of the pre-hospital and disaster medicine section at Emory as well. Within that role, I function as the medical director for DeKalb County Fire Rescue for Air Life Georgia, in the Atlanta metro region. And also I've been involved with biosafety transport and specifically an instructor for NETEC for the last few years since I started on faculty at Emory. So that being said, it's been great to be part of this team. And I was happy to receive this first question because I actually had COVID back in April. So I can relate to this personally and try to add that to my answer. So first, there are a few things to consider. I think the first thing to consider is immunity. So what do we know about immunity? Yes, we do develop a COVID-specific immune response, partially antibodies, and also a cell-mediated response that's introduced following infection. So that's comforting from my standpoint. Preliminary evidence does suggest that some of these responses are protective because well, really, but remains to be definitively established. So we can't say that for sure. This is a lot of ongoing information and research. Moreover, it's unknown whether all infected patients mount a protective immune response and really how long that protection will last. Nevertheless, the short-term risk of reinfection, like within the first few months after the initial infection, appears to be low. Additionally, the durability of the neutralizing antibodies and the neutralizing activity following the infection is really uncertain. We do know that neutralizing antibody titers or concentration declines over several months after the infection. And this mirrors actually what we saw with the SARS outbreak back in 2004, where antibodies were detected up until 3 to 6 months after the initial infection. Secondarily, you do develop CD4 T cells, so a cell-mediated immune response, and it appears to be, these T cells appear to be cross-reactive with antigens from the common cold coronaviruses. They're also a coronavirus, which is interesting. So we know that you're mounting an immune response. Now, what about reinfection? So testing positive after you have a preliminary infection, that doesn't really necessarily indicate reinfection. And in fact, if it's a PCR swab, you can detect viral RNA that remains associated with your cells in the nasopharynx for months after your primary infection. So if you test positive, that's why the CDC recently removed recommendation to have a staggered testing approach before returning back to work. So we don't really know what that means, and testing is getting better as we go through this pandemic. There are several ongoing antibody trend studies that are happening currently. So there's not enough known to recommend against using PPE after you've been infected. And that's kind of the third point of this slide is PPE guidelines should still be continued to be followed. If you're in a healthcare setting, airborne contact with an eye shield or face shield rather, as indicated, is still recommended by the CDC even after you've been infected. In the community, mass social and physical distancing is still recommended. And of course, public health measures like stay at home, public gathering, bans, travel restrictions, those are going to maintain in effect, even if you've had the virus in the viral infection before.
Thank you very much. These are all great reminders, especially about the mass social distancing and staying home when you're sick. So the next question that was submitted, I'm going to pitch this one to Wade. And Wade, if you'll please introduce yourself before you answer. My employer has provided us with several different types of PPE, but we haven't really been provided the guidance on how to use it. How should I educate myself to make sure I'm wearing it properly? Wade?
Great question. Thank you, Amanda. My name is Wade Miles. I'm the Operations and Training Manager for Emory University's Office of Critical Event Preparedness and Response, as well as a pre-hospital disaster medicine, also on faculty here at NETEC. I'm a 25-year paramedic. I've served in all positions from basic EMT up through Director of Operations. I also led the Ebola transports with Grady EMS biosafety transport team back in 2014 and 15. So for this topic, I think it's very unfortunate if employers are choosing to not properly educate their employees on how to properly use PPE, because we do know PPE is very important. I will say OSHA requires employers to ensure employees are medically cleared, properly trained, and fit tested to use a respirator such as an N95 or PAPR. If this is not being done in your services, I encourage you to speak with your leadership team and see how they can rectify that. Some gowns and coveralls may have manufacturer recommendations for use. If not, there are many resources on the CDC, NETEC, and ASPR Tracy websites. We highly recommend using checklists for donning and doffing your PPE. We know that healthcare workers are especially at risk for exposure during the doffing process if it's not done properly. So we believe using a prescribed checklist will help to ensure that steps are being followed properly, therefore limiting potential exposure. Using the buddy system is also highly recommended from our team for donning and doffing. Just having an extra set of eyes while you're donning and doffing your PPE will help you to ensure the process is followed as prescribed. Again, there are many resources on the cdc.gov, netec.org, and the Ask for Tracy websites. Ask for Tracy is ASPRTRACIE.hhs.gov. And if you go to Ask for Tracy, look for the EMS playbook.
Great, thank you. And again, if you're still having questions, maybe that seem very personal to your kind of department, please feel free to reach out to NETEC as well, and we'll be happy to get one of these panelists or another subject matter expert to help you. Thank you. All right, the next question that was submitted has to do with fatigue, and fatigue is rising. What techniques can we utilize to continue to meet PPE compliance? I'm actually going to ask Dr. Kumar to answer this question after she introduces herself.
Hey, thank you so much, Amanda. My name is Lakshmi Kumar, and I am on faculty at Emory University, and I work as an ER physician at Emory University Hospital with Mike Carr. And I also serve as the medical director for Great EMS, which is a large hospital-based EMS system with an annual call volume of around 130,000 within the city of Atlanta. In addition to this, I've been working with NETEC for the past few years and thankful to be part of the team, especially during these times. So as far as the question is concerned, this is definitely $1 million question, given we're all seeing changes and the rise in fatigue and sometimes varying degrees of non-compliance. Before we go into any specific techniques, I think it's really, really important that we understand the barriers involved so that we can come up with ways and means to deal with some of these issues. We looked at studies and data, and there was a good review on different barriers that we are seeing and causes for fatigue. And this was not just with COVID, but previous pandemics, previous infectious diseases that have happened over the past few years. And many of those components, are important to understand, and we need to see how best we can deal with them within our organizational structure. When we look at organizational factors, task burden was a huge component. We need to understand that utilizing PPE and establishing cleaning routines, especially in a high turnover environment, can be especially taxing. It definitely slows our providers down because they have to go through thorough donning and doffing and often time-consuming cleaning routines. So we need to consider how best we can support our staff. So increase the number of staff, or maybe it's a question of adding personnel during a pandemic when many are, and this could be challenging in its own right because many are unable to work with secondary to illness or childcare issues, or we might have to consider shorter clinical shifts, but do something to decrease burnout and also recognize fatigue. Recognition of fatigue is really important, and this can be challenging. So we need to look into our own systems to see, are we able to ramp up staffing and prevent burnout, especially in a system that has a high utilization, high unit hour utilization. The other thing is there was a dental study actually that talked about dentists and dental hygienists complaining about headaches and dehydration secondary to prolonged PPE use, and they mentioned water break reminders because people tend to forget, keep PPE on, and even though we have they highlight the importance of extended use, we might want to have built-in breaks to actually take a sip of water to make sure that we're doing okay. The other thing is education and training. Remember the principles of adult learning. We need to not just provide training on donning, doffing, and decon, but the underlying rationale of why this is important. And reminders on all of this is definitely helpful and important. We want to make sure that our agency guidelines are not too long, not difficult to follow, and importantly, they adhere to national guidelines. When we have long-winded guidelines that are difficult to understand, often personnel perceive this as being confused and they don't feel that the guidelines are good enough. So they need to be succinct and they need to follow national guidelines. And this is definitely a key element to ensuring there's no confusion among your workforce as to what to follow and what they need to do. We need to have clear communication strategies, both communication reminders as well as changes. So we all know that there are always changes that are happening as we understand more about this disease, but we want to make sure that we message our staff and we are communicating these changes. Email fatigue is real. I am sure that everybody on this call is experiencing email fatigue to some point, or webinar fatigue as well. But we need to make sure that we are limiting this. So if we're sending out an email maybe just once a day, and it should be clear, succinct, and they should have a repository to access the latest guidelines if there's any confusion at all. And most importantly, we need to think about, are some of these implementable in our workplace? Do we have access to PPE? Get input from your staff as to the daily happenings. And make sure that you let your staff know about supplies, quality of PPE, and identify environmental risks early, access points, patient flow, where can they hand wash, to ensure compliance. And of course, monitoring is important. And the biggest thing is modeling. We need to make sure we do it. And when people see us do it, they will follow along and do it as well.
Thank you. Fatigue is a big topic, so there are a couple other facets of that we'll touch on with some of the other questions you guys submitted. All right, the next question you guys gave was, given limited resources of N95 masks, should we be saving our masks and PPE for COVID positive patients? And I'm going to ask Ben to answer this question and introduce himself.
Hi, yeah, thanks, Amanda. My name is Ben Tizer. I'm a fire apparatus engineer, paramedic with the Omaha Fire Department in Nebraska. I've been in the fire and rescue service for 8 years. Back in 2014 and 2015, I was also involved with the transport of Ebola patients to the Nebraska Biocontainment Unit on the UNMC Nebraska Medicine campus. And I also am an instructor with NETEC. So good question on N95 masks, saving them. I mean, it's obviously not a secret that PPE has been hard to come by these days. Shortages of N95 masks, gowns, gloves have forced agencies and institutions to find creative ways to reuse or extend the life of certain aspects of PPE that we've never had to worry about before. But we have to also maintain the highest regard for the safety of our healthcare providers. Certain pieces of PPE can and should be used for reuse. Gloves and gowns are obviously one-time use and should be disposed of properly. Eye protection can be disinfected and reused again. And N95 can also. The decision to implement these policies that permit these extended use or reuse of N95 respirators should be made by the professionals who manage that institution or agency's respiratory protection program. And they should really consult with their occupational health, their infection control department if they're available, or the state or local health department to give guidance also. Just a couple of definitions. Extended use refers to the practice of wearing the same N95 respirator for repeated close contact encounters with several patients without removing it in between patient encounters. An example of this would be a dedicated COVID unit in a facility where the staff wears the same mask throughout their entire shift without removing it in between patients. Really not applicable to EMS. Reuse refers to the practice of using the same N95 respirator for multiple encounters with patients, but removing it or doffing it after each encounter, and then using it again, redonning it prior to the next encounter with the patient. Storage in between these uses becomes the important issue. We see masks hanging from rear mirrors, thrown on the dashboards of your vehicle, fire trucks, ambulances, sitting on the chair. You've probably seen some unique places for these masks, obviously, which are probably not optimal for appropriate infection prevention and control. An appropriate recommendation, and you can see in the picture on the right on the slide, is to put the N95 mask in a breathable bag. When I say breathable, it means not a plastic bag. A paper bag is actually a breathable bag, and one that has handles. And this is just a simple brown bag, but if you'd like to get creative, there's holiday bags. You can decorate your own bag. But it's important to identify the bag with your name on it and identify your mask as well on the outside with your name on it in an effort not to inadvertently use somebody else's mask. The shelves on the left this is actually a shelf from one of our local hospitals that keeps all their employee masks in there in between shifts. This could also easily be implemented in EMS or a firehouse. Just find a closet, put these bags on there with the shift masks on there. As far as the maximum amount of reuse on N95 respirators, there's really not a hard number that applies to every respirator. It's really going to be up to the manufacturer and their recommendations on how often or how long you can use a mask. But there are a few tips that you can use utilizing N95 respirators. You need to discard your respirator following an aerosol generating procedure. For example, the back of an ambulance, if you're giving somebody a breathing treatment, you should really discard that N95 after that. You need to discard N95 respirators contaminated blood, respiratory, or nasal secretions, or other bodily fluids from the patient. Clean your hands with soap and water or an alcohol-based hand sanitizer before and after touching or adjusting your respirator. And avoid touching the inside of the respirator. If you inadvertently make contact with the inside of your respirator, you have your dirty gloves on, you can discard that respirator, you can contaminate it using an approved method before you use it again. So some simple methods, the CDC guidelines, there's a link on the bottom of the slide that has a little more information on this. Some PPE can actually safely be reused or extended use, such as your N95 mask. Thank you.
Great, thank you very much. Just a reminder, if you do have a question, please put it in the Q&A, not the chat box. Otherwise, it will not be answered. So please put it in the Q&A. Any questions we don't get to by the end of today, if we don't have extra time, we will answer those for you and have those available. Our next question is, what if we respond to an NVA and do not suspect the patient has the virus? Do we still need to wear a mask? And I think this was actually submitted as a Q&A just a few minutes ago as well. So I'm going to ask Dr. Carr to answer this one.
Sure, and this is actually a question that I get a lot within my role as a medical director for a ground EMS agency. So, and as you said, so Richard also asked this question very similarly, just in the live Q&A now, saying should first responders wear this PPE when making patient contact before the ambulance arrives, regardless of the nature of the call. So the quick answer is yes, you should be wearing some type of PPE. And in fact, you know, you have to remember, we're in a pandemic. You know, expect that existing infection prevention protocols and recommendations will and should be followed until we're declared over or ended. Many regulations will actually stay in place beyond the official ending of the pandemic. That being said, a lot of public health, a lot of regional and local public health guidelines will be developed based on local risk and local factors for depending where you live. So one of the ways you can consider that is, you know, consider your local incidence of infection. You know, if you live in Vermont, it's a very different experience currently than if you live in Georgia, let's say. You know, it's ongoing and changing, so guidelines will continue to be addressed and changed. You can calculate your local risk knowing that factors may change the current predictions, like you know, people are flying more in airplanes. You know, we're seeing increasing travel. People are visiting from outside of the state. We're seeing increases in large gatherings. You can also go to the CDC website and look at their COVID data tracker and look at your specific region to see what your local incidence is doing. That being said, what do we know about COVID? COVID has an R0 or an R sub-0 ranging between 2 and 4 based on current mathematical models. What that means is for every person who gets COVID, they're likely to infect between 2 and 4 people. And that's a scary number. That's a very high number. So a lot of the reason that is happening is because, as you know, there's what's called asymptomatic transmission and pre-symptomatic transmission. So, you know, considering that the percent of infections that are estimated to be transmitted asymptomatically is between 20 and 50%. That is huge. That's according to ASPR and the CDC. And in fact, if you go on the CDC's website, they've performed 5 different scenarios, which are mathematical models, where they provide a current best estimate based on current data and the known rate of spread. We're seeing about a 40% asymptomatic transmission rate, and 50% of the time transmission can occur prior to symptom onset. If you're a medical epidemiologist, that is terrifying, trying to track and trend this as we go is increasingly difficult. So as I said, we're in a pandemic. There are protocols in place to prevent spread. So if you are responding to a call and you have a community level interaction, meaning if you are, if you're doing a lift assist, if you are, if you are just, you know, getting, I don't know, I'm trying to think of something, getting a cat out of a tree. Maybe that's extremely cliche, and I apologize, but you know, you should maintain your local community guidelines and recommendations. So wearing a mask, practice social and physical distancing. That being said, an ambulance, a fire engine, these are all considered healthcare settings. So if you are responding to a medical call of any nature, the CDC recommends following public health measures that are recommended, which is to continue wearing a mask, a face shield, and contact precautions for every patient encounter. So that's a long-winded answer, but there are a lot of things to consider. Ultimately, though, you know, your interaction as a first responder is a healthcare setting, so I would continue to follow CDC guidelines and maintain your appropriate PPE. I hope that answered the question.
Yes, it did. Thank you very much. I appreciate it. So another question that got submitted is, what if it's an intra-facility transport and the patient is known negative? So you're going between facilities, and I'm going to ask Wade to answer this question.
Thanks, Amanda. I think what the questioner was asking here is if PPE is required. That's my assumption of the question. And as Dr. Carr has indicated, the short answer is yes. We know that negative tests don't always ensure that the patient's 100% negative. They can have some false negatives. Therefore, we recommend following CDC guidelines for all patient interactions. Standard precautions are required, and transmission-based precautions, if required, based on the suspected diagnosis. And what I mean by that is, if the patient has some other diagnosis other than COVID-19, that would require additional PPE above and beyond the standard precautions, and those guidelines need to be followed as well. So standard precautions, we're saying face mask on patient for source control, gloves, eye protection, and N95 on the providers. If an aerosolizing procedures are anticipated, gloves, N95 mask, eye protection, gown, and coveralls are required. We recommend leaving the back and side doors open and exhaust fans on high if possible. Obviously, we know if you're driving down the road, this is not possible, but if you're still on scene and you have to, intubate a patient or give a nebulized treatment or something, then we recommend leaving the doors open and the exhaust fans on high. And we also recommend limiting the number of providers in the patient compartment to just one, unless more are required to provide life-saving patient care. You have a CPR patient or some critical patient that you're managing, with it takes more than one patient or more than one provider to manage. If not, then we just recommend having one provider in the back of the ambulance.
Great, Wade, thanks. Those are a lot of great tips. The next question submitted was, should we be wearing masks and social distancing at our EMS headquarters? Dr. Kumar, do you mind answering?
Sure. So I cannot emphasize the importance of source control enough. Like Mike said, with the amount of asymptomatic transmission just prior to symptom development there is in the community, it is really important that we should be following masking and social distancing even within our EMS headquarters. So, I mean, a huge component of source control, whenever we think of source control, we think of putting a mask on the patient, but we should also be putting it on. Personnel should wear a face mask at all times while they're on service, including break rooms or other spaces where you are going to encounter coworkers. And it's important that we remind our personnel about hand hygiene before or after any contact with a respirator or a face mask. You want to try your best not to touch your face. And if you are going to touch it or touch your mask, make sure you either wash your hands or sanitize your hands before and after. It's important that we designate areas for EMS personnel to take breaks, to eat, drink, think about all that. Think about the fact that they still need to be 6 feet apart, especially during break times when they're eating something or drinking something, because these are the times they are going to take their face masks off. And of course, we should encourage non-essential personnel to work from home like before, and continue with symptom screening when people come in. Yes, there is the risk of asymptomatic transmission, but it's also important to symptom screen. And it also serves as a reminder for people to, it gives them that self-awareness to monitor themselves for symptoms when they come in, and think about it and call out if they start developing symptoms, or, get tested.
Great. Thank you very much. So I've heard this asked several ways, and I think we even got it as a question earlier, but this question was submitted saying, I work in a fire service, so I spend a lot of time with the same people. Do I really need to wear a mask and socially distance at the station? Ben, do you mind answering this one?
Yeah, sure. Thanks, Amanda. Yeah, certainly this is a very applicable question. The use of face masks has been a highly contested issue since COVID-19 emerged in the United States, and first responders have been on the front line, not only the pandemic, but the mask debate as well. I'm going to echo some of the things that Dr. Kumar stated in her previous answer to the question. Most fire departments are required by some kind of policy to wear a face mask in the event that adequate social distancing can't be maintained in the fire station. Obviously with the goal of reducing COVID transmission within the ranks. The evidence with the mouth and nose covering face masks, reducing dispersion of droplets from an infected individual, certainly do help limit the spread of the virus. But despite all this evidence and the recommendations, some individuals, including some first responders, have pushed back against this while on duty for various reasons. But in an attempt to relieve some of the fatigue and to not require everybody at the fire station to wear masks all the time, you can employ some tactics to help. You're effectively able to social distance by doing things such as setting up indoor traffic flows around the firehouse one way, shift, the oncoming shift goes in one door, the outgoing shift goes out the other door, limiting your indoor physical fitness activities in the exercise room to one person. You could probably get away with not having to wear a mask. Limiting the number of people preparing meals in the kitchen if you do that at your firehouse, and then staggering meal times or sitting spaced around the kitchen or your dining area to limit your contact might also be able to help you reduce the amount of mask time you need while also maintaining safe distances. Controlling environmental factors such as having individual sleeping areas, keeping your furnace filters up and clean, and having different study areas when possible will reduce the mask need for continuing use all day. But when you're not able to social distance due to some other limiting factors, you have to continue to wear a mask. Not necessarily for ourselves, but there's other members with children or elderly or those that have potential medical issues that we really need to watch out for. Firefighters obviously didn't cause this, but that doesn't mean we can disregard the effort in helping mitigate this, such as wearing a mask or social distancing. We also don't cause the structure fires that we go to, but we wear breathing apparatus when we go in there and protective gear. Is it because we have to or because we want to? We want to protect ourselves and others. Is it comfortable on a hot day? No, but we do it because we have to. We do other duties where we have to wear specialized gear, high-angle rescue. Again, it all goes back to keeping yourself and others safe. You'll likely get used to it. We made the commitment getting hired to set the example, do the right thing. And sometimes a gentle reminder of your coworkers doesn't help. And I'll just leave you with this. We're on track to lose more firefighters to COVID-19 this year than all other combined reasons for line-of-duty deaths in the fire service. The one virus alone will double the number of work-related deaths for firefighters this year in the country. And I believe we can help reduce this number by wearing masks around the firehouse. Thanks.
Thanks, Ben. A really important reminder. This next one takes this kind of down a little bit further and asking if my partner and I, if we're on the same shift in the same ambulance together for 12 hours, do we really need to wear a mask when we're not transporting a patient? So I'm going to ask Dr. Carr if he can answer this question.
Sure, happy to answer. My first initial response to this, and probably the most important one, is that Batman and Robin wear masks for their entire shift and they don't take them off. I highly recommend you do the same. All joking aside, there's kind of a multifactorial response. first of all, how well do you know your partner, right? If your partner is your spouse or a family member or a roommate, somebody that you spend a substantial amount of time with normally, that might be something you take into consideration. When there's no patient in the posterior compartment, you might consider not wearing a mask. And ultimately, I would say that is completely up to you. That being said, private organizations and governmental organizations will have policies that are developed and informed by public health guidelines recommending the use of masks. Most agencies and institutions are going to recommend wearing a mask at all times while you are in the workplace, right? So the other thing to consider, how well do you know your partner? Do they have family members at home with COVID-19 symptoms that you don't know about, right? They might be an asymptomatic transmitter. Similarly, do you or does your partner have family members at home who are immunocompromised or elderly, who would be at increased risk of having a bad outcome if they contracted COVID? Those are things to consider, and that ultimately I think would support wearing a mask at all times. Other things I mentioned before, asymptomatic transmission. Remember the transmission of COVID, 20 to 50% of the time will be asymptomatic or pre-symptomatic. Are you or your partner asymptomatic or pre-symptomatic spreaders? It's possible. So, in a nutshell, an ambulance is considered a healthcare workplace. Healthcare professionals working in facilities or ambulances or fire engines located in areas with moderate to substantial community transmission are more likely to encounter asymptomatic or pre-symptomatic patients and colleagues and coworkers with COVID infection. So you can try, wearing a mask when you are less than 6 feet apart. If you are sitting in an ambulance and you're driving and your partner's in the front seat, if you can reach an arm out, your arm's about 3 feet long. If your partner's arm is about the same length, then maybe you're about 6 feet apart. That's a pretty big ambulance though. So depends what you're driving, or a fire engine. Consider rolling the window down if it's nice out. Just rolling the window down and putting the vent on high, as Wade mentioned earlier, putting the exhaust fan on something other than max AC, because that recirculates, is going to rotate and exchange the air. There are some studies demonstrating over 100 air exchanges per hour if you crack the windows in the driver compartment and put your fan on exhaust without recirculation. So things like that you can consider. But in general, the more closely you interact with others and the longer you're in that interaction, the higher the risk for COVID-19 spread.
Thanks, Dr. Carr. We're going to try to get through a few more questions. Once I take my mask or other PPE off for a break, can I put the same PPE back on? Where do I leave my mask or store it? Dr. Kumar?
Yeah, thank you for that question. This is definitely a tough one, but CDC does say that extended use is definitely preferred over limited use, over reuse. So you want to try and keep it on for a longer period of time rather than take it off and put it back on multiple times, because that just increases your risk of infecting yourself. You need to know when to discard your N95. If you've had an aerosol generating procedure, if there's obvious contamination, there's close contact with any infected patient, or if you've worn it a bunch of times and you feel like you've gone through the sanitization process and you take it and put it back on and you don't feel it fits right, and when you blow, you can just feel the air coming out. Those are all reasons to discard your mask. Definitely perform hand hygiene before you put on your PPE, and also perform a seal check every time you put it on or take it off. Every time you put it on after taking it off. Now, the other question in this was, once I take my mask off for a break? Can I put where do I leave the mask, right? And that's yet again another difficult question, because it's tough. Do you put it on the surface counter? Do you put it in a bag? How do you store it? Because there are a lot of guidelines on where to leave it. Say you've used it and you want to reuse it in a couple of hours. There are guidelines as to put it in a breathable bag, like Ben said, and to make sure it doesn't touch anybody else's PPE. But there isn't really specific guidelines if you're taking it off for a super short time. But I would say follow the same principles. Make sure that it doesn't touch anybody else's PPE, that it's well labeled so nobody else is touching it. Make sure it's either, face down on the surface where you're not touching the possible contaminated parts, and you're picking up your mask only by the straps. I've seen people hang their mask off like Q-tips, off their computer monitor so that it really doesn't touch anything, or on a hook, or off their dash so that it doesn't actually touch anything and they're able to just hold it with the straps. But ideally, the main thing to remember is you want to try and not touch your face, and try and follow the principles of extended use.
Thank you. Yes, I think in one of Ben's questions, he had a nice picture of it in a paper bag or breathable bag, and using something with handles so you could hang it. And I think too, your important point about seal checking, if you don't get a seal on your N95, make sure you're getting a different mask. Thank you. Next we have, I see healthcare workers in hospitals wearing less and less PPE. Why do I still need to wear full PPE in every single patient encounter? And I'm going to see if Ben doesn't mind answering this question.
Yeah, sure. It does seem sometimes that other healthcare workers in the hospital setting or the emergency department, as EMSCs, aren't wearing as much PPE as even a couple of months ago. So fatigue is clearly not unique to pre-hospital fire and EMS of the healthcare system. It's all over. First, you don't have to wear quote-unquote full PPE on every patient encounter. Rather, you need to wear the appropriate. It might be full PPE, but appropriate is most important. Most agencies don't require their personnel to use the highest level of PPE on every single patient, regardless of what their complaint is. And the rules are evolving as we continue to learn and understand more about COVID-19. So it may be true that hospital workers appear to be wearing less PPE than even a short while ago, but there's probably some explanation for it. Most facilities have made some environmental changes to their indoor patient care areas, including modifying traffic flow through their departments, establishing zones for different patient complaints and illnesses, and then also modifying their airflow systems to increase the negative airflow and air exchanges per hour. Some of these changes might result in requiring personnel who are only directly caring for patients with COVID-19 signs and symptoms to wear the high level of PPE, where other people in that same department, through effective social distancing and air exchanges, could get away with wearing maybe a little bit less PPE than those directly involved in patient care. But in the field, responding to house calls or other environments to which we're unfamiliar with requires EMS and fire to be prepared for unknown. We have no idea what contaminants are in someone's house or what everybody has going on in there as far as their health and respiratory status. And we can be fairly confident that there's not any negative pressure or high air exchanges in your house either. But we can institute some simple practices to reduce the PPE fatigue of EMS response, such as, and I'm sure many of you do it, donning only one provider in the maximum amount of PPE to go in the house to provide that initial assessment. And if you can, attempt to get that person to walk out to the ambulance and load themselves in there so your partner or the other members of the crew don't have to don their entire PPE every single time. Again, appropriate PPE in the pre-hospital setting might not include full PPE for every response, but you certainly have to be mindful of the appropriate PPE for all the providers that are becoming in contact with these patients.
Thanks, Ben. All right, well, since those of you who don't know, that's actually Dr. Carr on this slide, so I'm actually going to ask him to answer this question. But the question is, I like to follow the rules and support wearing a mask at the fire station, but my coworkers tell me it's not necessary and none of them wear masks. My boss isn't enforcing the mask mandate when we are at the station. What can I do to deal with this situation? Dr. Carr?
Sure, that's a great question, and I hope everybody has at least some, has developed some kind of level of fun and fashion while choosing their masks, if that's acceptable in your workplace. So this is actually a picture of me that I'm wearing a mask that I got in Yellowstone, and it's just the nose of a bison or a buffalo that offers a little bit of fun to putting on the mask. So again, a multifactorial question, but the first point I wanted to make is really to be a good example. It's not that your boss or supervisors, it's not that they're intentionally disrespecting you. I would say it's that their convenience or their comfort outweighs the sense of self-preservation or obligation to contribute to a societal cause of masking everybody, right? So it's maybe a personal decision, or maybe it's a miscommunication or misunderstanding. That being said, I think the first order is to be a good example. Make sure you're always wearing a mask. If you want to ask others to comply to a policy, you have to make sure that you are adhering to the policy. Have extras to share. Now, this is, you don't want to force a mask upon somebody if you feel that might invade their privacy, right, or invade their right. But if it is an institutional recommendation within your agency, then consider having a box. Costco has a huge a huge box for very little cost, or you could probably find another box of just surgical masks. That's, by the way, no official recommendation for Costco, but that masks are increasingly available to help with the spread. So be a good example. Consider masks as a fashion statement, right? We're seeing this more and more, or as a conversation starter, as is with my photo here on the right. If there's some kind of an appeal to wearing a mask that is funny or has something workplace appropriate on the front, then that might be a way to kind of approach this. Of course, you can silently reinforce your desired behavior through visual cues. If somebody's not wearing a mask and they come up and start talking to you, take a few steps back. Let them know that you're trying to follow the recommended guidelines, and that we are in fact in the middle of a pandemic by taking a few steps back and extending that bubble around you. You don't want to be, in general, I would say you don't want to be that person who's spewing off facts, but in my case, that tends to be what I do, usually with a little bit of humor, kind of passively educating with reliable resources. I say that because there's a lot, as you know, there's a lot on social media currently. If you find a meme and put it in someone's face as a reliable source of education to recommend wearing a mask, they might not believe you, and it might hurt your cause. Consider staying up to date with the CDC's MMWR. If you subscribe to this email every week, or a few times a week actually now, you'll get an email with ongoing epidemiological studies looking into the use of, or looking into wearing masks and how effective it is. You might recall the hairstylists out in that was, I believe, in Missouri. There are two hairstylists that tested positive for COVID-19, and they did some contact tracing to see who out of the customers and clients tested positive. This is an area where they determined that wearing the mask was effective. The investigators found that none of the hairstylists infected 139 clients or secondary contacts, and none of them became ill or developed symptoms. There were 67 of those clients who volunteered to be tested, and none of them tested positive or showed signs of infection. So that's something that you could cite, right? That's a officially well done case study. You could consider the Boston Hospital study. The MGB did a study, and they were able to demonstrate decreased transmission within the workplace by wearing masks. So, these are a few options. And in general, I would say there is increasing acceptance based on survey data that people are increasingly accepting the social norm to wear a mask. One survey showed out of 500 adults in April showed that 62% would wear a mask, and just 1 month later, they're up to 76%. I haven't seen the update to that study but we have increasingly acceptance of the of people wearing masks. And of course, if it's a workplace policy, you should escalate it if necessary. If your immediate superior is condemning you or recommending against wearing a mask, consider escalating to their supervisor. If it is a workplace policy, it needs to be followed. If it's not, if there's no policy, encourage the policy development within your workplace based on local public health guidelines that are usually informed by CDC, incidence trackers, and whatnot. You could also consider an anonymous reporting system. That's a lot of the times what hospitals and facilities would put in place if they need to track somebody wearing a or following a policy.
Great, thanks, Dr. Carr. And due to time, I think this is going to be our last question, and I'm going to pitch this one to Wade. Wade, given we are in a truck and staged versus transporting a patient for most of the shift, it is tough to follow hand washing guidelines like you would in a hospital. Do you have any suggestions of how pre-hospital providers can deal with this?
Thanks, Amanda. Yeah, I think for anyone who's ever worked in a system that works system status management versus bases like fire stations, this has always been an issue, but probably more now that we're in a pandemic than it ever has been. So obviously you're in an ambulance, you don't have a place to wash your hands. So first, let me just some reminders. Hand hygiene should be performed before and after all patient contact with potentially infectious material, and before putting on and removing PPE, including your gloves. Hand hygiene after removing PPE is particularly important. So ideally, hands will be washed for 20 seconds using soap and water. When soap and water is not available, an alcohol-based hand sanitizer with 60 to 95% alcohol is recommended. And it's very important to use soap and water anytime hands are visibly soiled. The best case scenario, wash hands prior to leaving the hospital. We have heard scenarios where EMS providers, excuse me, are not allowed to enter the ER, so the patient handoff is done outside. In these situations, perhaps the hospital could set up a outside hand washing station. You can stop at local fire departments if they're allowing you to go inside, use the restroom, wash your hands there. You may have to use public restrooms to wash your hands. Maybe you're posting at the local BP or some gas station or something, and you may have to use the restroom in there to wash your hands. And it's always important to make sure you have plenty of alcohol-based hand sanitizer available in the cab of your ambulance.
Great, thanks, Wade. So I think we're going to go ahead and try to do one or two of the Q&As that are in that you all submitted. Our panelists have done a good job of trying to answer real time. But I pulled this one out kind of to the side to see if I could get Dr. Carr to try to answer a question of how does physical fatigue influence PPE fatigue and compliance? Dr. Carr, do you mind touching on that?
Sure. Another great question, and this is another consideration in following procedures and protocols, and also with protocol development. When you are, if you are developing protocols for, let's say, your fire agency, and you're trying to adhere to public health guidelines, the other thing to consider is the physical component of wearing a mask, right? Now there are plenty of I would say complaints in the community about wearing a mask and possibly not getting enough oxygen, and that might contribute to somebody's physical fatigue. Pretty consistently, there are demonstrations that you're not affecting your oxygen saturation or your oxygen physiology by wearing a mask if you are of normal health and you have normal functioning lungs and heart. That being said, if you are chronically hypoxemic from a underlying lung condition, maybe it is unsafe to wear a mask. That would have to be addressed on an individual basis. Now, having physical fatigue and maybe physiological fatigue, we can call it, from wearing a mask, I think is unlikely, but still possible, and should, as I said, just be considered when developing these policies and procedures. Now, I don't know if that answers the question, if there was another specific component of that, but happy to elaborate further if needed.
No, I think that answers it, and you actually inadvertently answered 2 other questions that were in the Q&A, so thank you very much for that. So really quickly, we're going to go through a couple resources that we have to be able to offer to you. So NETEC is here to help. We're happy to help you in any way possible. We build resources, develop online education, and deliver the technical training to meet the needs of our partners. Again, feel free to send any questions that you have to info@netec.org, and we will get our subject matter experts to answer them for you. Or you can submit a technical assistance request at our website, www.netec.org. Again, we are on social media. Please feel free to join our conversation. We do have lots of skill videos listed on YouTube, as well as we do have online courses. I would like to take a moment to thank all of the wonderful panelists that we had on today for their time, and all of you for joining us for today's webinar. Feel free to join us for our next webinar. Thank you all so much.